Thank you so much for staying with us here on Morning Live. Really appreciate you tuning in. Now, yesterday, Minister of Health, Dr. Zweli Mkhize, led the social cluster briefing regarding the amended regulations under lockdown level 3, which had been announced by President Cyril Ramaphosa on Sunday night. Now, Minister Mkhize said that a surge in COVID-19 infections is coming and that it could be even higher if government doesn't tighten lockdown restrictions. The minister joins us now to discuss this further. Minister, always a pleasure having you. Thanks and welcome once more to Morning Live.
Good morning, Sakina, and all the viewers.
Minister, we just had a very disconcerting interview about sanitizers, and we know right now, along with wearing masks, sanitizing is one of the things that we need to do constantly. But it would seem as though we are being ripped off in terms of buying sanitizers that do not meet the regulations and stipulations. Is government aware of this, and what are you doing about this particular matter?
Well, we are not aware that there are those kinds of specific instances. However, we believe that everyone who is selling a sanitizer needs to have been properly vetted through SABC, and so we are sure that the safety standards are adhered to. But it's something that we will have to be more vigilant to ensure that we protect the public from any unscrupulous individuals who might decide to sell something that is not effective. But I was just listening to this report. I think that is something that we need to pick up so that we become more vigilant. Generally, anyone who sells this stuff has to be registered. SAPRA must be able to certify that it's a correct component. And if it's in the case of other equipment, also SABC needs to also be involved. And people must really try and do the right thing. But we will be picking up this matter and following it up so that we try and protect the public from, because this would be dangerous if someone thinks that they've got sanitizers that are effective only to find that they are not. That's a problem. And also we need to look out for any side effects. People can't be sold stuff that could be damaging to their skin. So we will have to follow that up.
Minister, you also said that, we are now looking at a surge in the number of infections, and this is coming. We are basically in the storm right now. Could this be even higher, the surge that you allude to, if government doesn't tighten lockdown restrictions?
We are concerned that the numbers that the modelers were indicating that the surge is coming sure in July and August and September, that we were tracking a little bit better than the optimistic scenario, which means we're a bit lower than what was anticipated. However, we were concerned that those numbers are variable. They depend on whether the public continues to be very strict on distancing, sanitizers, and wearing of masks, because the numbers can in fact get worse if we are negligent and we allow the situation to get out of control. So we have to keep the awareness of the public to their sense of responsibility to make sure that they help us to reduce the spread of infection and reduce the numbers. The surge is coming. It's just about here now. If you look at the numbers that are happening in Gauteng, KwaZulu-Natal is picking up, and Eastern Cape as well. Although Western Cape seems to be, in a kind of a plateau. We're not having any a very huge increase in the Western Cape, but we think that we have to observe all of these trends. The key issue is our behavior can influence those numbers to go up or go down.
And speaking to these models and fully appreciating the challenges that come with that, are you able to give us at this stage, Minister, an estimate of how many infections we are expecting and also what we could expect to happen after the peak? There's talk about things like herd immunity. What sort of conversations are you having around that in particular?
I don't normally like using these numbers, but just to give you a sense, we were expected to have positive cases, about 300 or so thousand by end of July. We're reaching 300,000 before then. And then secondly, the numbers of people who would be infected at any one time, in August would be very close to 1 million. So those numbers are what we're watching. But now the nature of the estimations in terms of these numbers needs to take into account that we're only testing people who are tested positive. There are those who may have no symptoms but still having the infection, and therefore will miss all of those. This is happening all over the world. The numbers that are recorded is not necessarily equal to the numbers that might be having the infection, because we won't be able to find everybody. So this is the trend that in every country we must know is the challenge. But having said so, we need to get to a point where the numbers of people who are getting infected is less than the numbers of people who have recovered. And it must continue like that. Then we know that we are stabilizing and we're moving towards the pandemic stabilizing. The issue of herd immunity is really based on a critical number of people being infected and therefore developing adequate immunity so that they no longer get an immediate reinfection. And therefore, we will find that the numbers that will be infected will not continue to increase, because some of those who are exposed may already be having immunity. So the infection chain actually stops at that level instead of continuing. So that is a little bit ahead of us. It's still a bit further. We don't have an expected time as to when that might happen. But nevertheless, what's important right now is that of those who are positive and those who have got symptoms needing admission, there must be enough numbers of beds in the hospitals. There must be enough numbers of nurses, equipment, oxygen to be able to treat them. And that is why we have instituted some of the restrictions that we have put in place, so that we can keep the hospitals open and ready to take up more people that might be needing to be admitted. So that's part of managing the surge on a day-to-day basis.
Minister, with regard to reinfection, so we always talk about the number of patients who have recovered. With the data and also the research available at your disposal, what do we know about reinfection and reinfection rates? Do we know of people who've recovered who have been reinfected with COVID-19?
That has been reported in Korea, where people were found to have turned to be positive afterwards. But all our researchers are indicating that that's a very small number. Firstly. Secondly, it is also not clear how they tend to be positive after they turn negative. But thirdly, because they are a small number, what has become dominant is the view that anyone who's got an infection after a certain period will tend to be positive even if they are no longer infectious. So we're not so worried about that, because the virus has not shown any changes in its genetic constitution, and therefore we don't believe that the numbers of people who will be reinfected is a significant issue. So at this point, we are not worrying. We're just observing it and we're watching the research around it, but we're not worried that it's a big problem. So we must say to our people, even if someone is found to be positive after, let's say, 14 days, and they must still be found to be positive, the evidence we have now is that they tend not to be infective at that point. Even if you got a record of the virus being still shared, that viral load they've got is so insignificant that while detectable, but it does not translate to a new infection to a next person. So that part, I would say we are quite comfortable with that.
And how about the patients in terms of how their bodies respond to this? Do we find that they actually become worse in terms of the symptoms and illness that they present with, or do they deal with it better?
Well, the reinfection is not a big issue that we have been worried about. What is important is from what the scientists suggest is that it depends on a number of issues. If someone is exposed to a huge dose of viral infection at the same time, they might tend to end up a rapidly progressing infection, and therefore those who might find a lower dose might actually have a milder infection. It does depend on their own state of immunity and other comorbidities and various other issues that might be associated. So all in all, it means therefore that the different levels of how people respond to the infection depends on how they're infected and how much of their immunity is able to cope with the situation. But having said so, we think that it's important for us to always remember the prevention also will reduce the amount of dosage of viral particles that will go into the individual. So using masks and sanitation, all of these issues will actually help to reduce the level of severity of the infection if it does get to the individual. But all in all, the reinfection is not a big concern at this stage.
Minister Mkhize, in terms of hospitals, you mentioned this, and we understand that a lot of them are close to capacity. What action are you currently taking to make sure that as the numbers surge, there will be the available beds, oxygen, ventilators, etc., to actually deal with the number of patients coming in?
At the moment, we have not filled our current hospital capacity. The hospitals that we have still got a lot of beds which have not been used. But what has happened is that for everyone who goes to the hospital now, we do what we call triage, which means we screen the individual and see whether the symptoms suggest that the person might need to be tested for COVID and therefore they will be negative or not. And therefore, we can keep them on the holding beds, which are at the outpatient level. Now, if the results come back quicker, therefore, we'll move the patient to the empty beds inside we decide whether the patient goes to the COVID negative side or COVID positive side. Now, the blockage sometimes happens on the outpatients when those people come into those beds. When they come in and find that the other people are still not separated, it creates a problem, therefore, that people think that it's full, when in fact it's the triage area that is actually full. But we're now increasing the numbers of beds. I'm going to be moving out to go and see now in George Mukari, where we've, in the past week, we've actually commissioned more beds so that we can expand the holding capacity at the triage levels in the fever tents, where we want to make sure that no one gets into COVID negative wards if they are positive, because then it will spread infection very much widely on the wrong side of the hospital. So that means, therefore, that we have enough beds at this point, but our prediction does show that there will still be a risk of us overshooting the numbers of beds if the numbers continue to increase. And so we're going to be providing additional beds. That is the point that the President was talking about. Then in addition, we've got oxygen piping that is being put into all these field hospital beds. But before we fit all of those pipes, we've realized the need to bring in additional oxygen tanks into various areas. So you might have seen that here in Gauteng, in Nasrec, we got the doctors and we're working with them. We're bringing in concentrated oxygen tanks to hold on for a while before those pipes are all fitted in. We're doing this in the different hospitals in different provinces so that the doctors don't get the frustration, because the numbers have suddenly increased. And therefore, those numbers need to be given attention on arrival with oxygen. So we are doing that. We're working with the oxygen gas suppliers, and they've actually been very cooperative and supportive. So we actually at this point we're managing. But in the next few weeks, all those beds will be filled with oxygen piping. Therefore, it becomes less of a problem. And then we've got a bit of a lead time to be able to provide additional field beds. It takes about 3 to 4 weeks to fit some of these hospital beds. So we think that we'll be able to cover. At the moment, we're ahead of the coming surge of the peak.
What about the staffing situation in hospitals, Minister? We've heard about frontline workers being infected. Are you able to just fill us in on the latest with regard to that?
Yes, indeed. Over the past few months, we've noticed that there's been a long-standing problem of vacancies which were not filled. So, given a directive that all those vacancies must be filled, and that's been done. Secondly, we've noticed as well that there are nurses who are out there unemployed that are on databases. We've issued instructions that they must also be reached out to so that we can get them to be employed. We've spoken to the medical association to also give us additional doctors who are registered and qualified to be employed so that they can be also employed. And we're doing all of that. Yesterday, I was also busy with the placement of nurses who we've asked the private nurse recruitment agencies that actually supply nurses to the private hospitals, and we brought those up so that they can also be helping us to reach out to the numbers of nurses that we need. We were looking at the databases. We're now also sending a message that there should be more work done to increase the training of nurses, and we will be expecting more doctors who are coming as medical students who are qualifying in Cuba. That's going to also increase the numbers. So all in all, we still have a shortfall, but with the way we're working, we will make sure that the shortfall doesn't affect us. We've also got a conversation with the general practitioners in private practice, as well as the specialists, to see how we can work out the conditions under which they can also come in to augment what is going on in the public sector. We've also agreed with the private hospitals that we will be able to share beds if government runs out of ICU beds or high care beds. We'll move patients onto the private sector so that they can be treated there. So all of this is part of the planning that we have put in place. Yes, we see that the numbers may be high. We're also trying to move ahead of those numbers.
Speaking to those vacancies and also just support in general to the various provinces, Minister, a couple of weeks ago, the National Health Laboratory Services told Parliament that the Northern Cape was the only province that did not have a virologist. And how have you dealt with that situation? Has one since been deployed to that province?
When you get such situations, we always make an arrangement where one area or one province or one hospital gets to be covered by the nearest available expertise, so that the quality of work and the supervision is not compromised. So we will continue to do that. Then, of course, we will be looking at additional capacity in terms of bringing in more of the experts that we need. We have had a challenge with the laboratory services, in the sense that a number of them, of course, have been affected by the infections. We all live in an area that's got a high level of infection, and from that point of view, the staff also gets affected. It therefore requires us to employ additional staff so that we can cover the space. And all of that we will continue to monitor so that it doesn't compromise the level of care that we need to put in place. We also have got an open line now of cooperation with the private laboratories, so that when there's any sort of backlog, there shouldn't be a difficulty in the private sector bringing the staff for the public sector laboratories to solve. And also the same thing, vice versa, to the private sector for helping with the backlog at the public sector level.
Minister, the Eastern Cape and the scooters, what happened there?
Well, the Eastern Cape issue is basically a provincial issue of the Eastern Cape. What they reported in our case was that they wanted to bring in scooters to assist the numbers of community health workers who have a difficulty in reaching the homestead because they've got to work on food. They get tired, they get exhausted, and they have to do some work in their own homes. And so this was to actually assist at that level. So they went ahead to procure them, and when they were releasing them, they of course invited us to come and observe that. Then they explained that there was an innovation to assist in the instances where there are difficult roads to move people closer to the clinics or to where the ambulances would be, and that they actually made that kind of a provision. Of course, these are not ambulances as such. These were supposed to be more to just assist in that, and then under those circumstances. So we have had since then, there's been a lot of debate about it. The matter has been referred back for the discussion between the provincial MEC, the department, and the portfolio committees, and all those who are involved to look into all the issues that people were raising. I think that the question of using of scooters assisting community health workers and some of the village nurses is something that really needs to be looked at. But then we will look at how far those investigations go, and then we can take the matters from there.
Time certainly is the enemy, Minister, but I want to squeeze in a few more issues here. Cigarettes. You were asked yesterday if you could provide information that would explain why cigarettes are still banned, the sale of cigarettes is still banned, and you said you would find out. I know it's a quick turnaround, but do you perhaps have any more information at hand right now to tell us about this?
No, you are asking a very different question. The issue which was asked yesterday, I was asked if I can find a record of how the banning of the cigarettes has actually assisted in the fight against COVID-19, and I said we hadn't done such research. The issue of cigarettes, let me put it this way. When first issue arose because the question was, are cigarettes is tobacco part of essential services? And of course, it is not. And then the next question becomes, does it help in the fight against, is the smoking the tobacco, does it assist in the fight against COVID-19? And of course, I have no such evidence. As far as I'm aware, any smoking has actually got a negative impact on the conditions of the lungs. It's one of the causes of cancers. It's one of the causes of chronic bronchitis. The coughs and chronic bronchitis and chronic lung diseases are some of those that are comorbidities that worsen the impact of COVID-19. Then, of course, there are other cardiovascular impact of smoking, the issue of peripheral vasculopathy, the nicotine effect on vasoconstriction of the vessels in the heart and different parts of the body. Those issues are very serious when you're dealing with comorbidities, and therefore, if there's any way you can prevent that, that of course is the way to go. And so our stand is very clear. There will never be anyone who persuade us as the health sector that there's any physiological benefit that we derive from smoking. There are addiction issues, and those addiction issues don't necessarily make it right. And so our focus is on COVID-19. But if anybody wants to ask us about the issue of smoking tobacco, we've got a very strong view that tobacco has, over the years, contributed to the morbidity and mortality of various individuals based on different forms of manifestations beyond the people who have got diabetes. If they smoke, that also affects them, and the various researches that have been done over the years that led to the intensification of the regulations against smoking comes from that research. So we wouldn't really argue at this point that we need to be drawn into the issue of opening up smoking or not. From the health point of view, there's no benefit from smoking. From other commercial and other purposes, well, of course, that's a different matter. But when we're talking health, there's no benefit from smoking.
Well, Minister, that's a pretty categorical answer there, and I wish we could talk more. I want to ask you another question, but I know we're going to overrun and we'll be cut off, so I'm not even going to venture there. But just a quick one.
You can send me as WhatsApp or SMS.
I certainly will. But if it were up to you, would the lockdown regulations be stricter than they are right now?
These lockdown rules as they stand now, they are actually with the recommendation of the health sector. And we would not necessarily be asking for a whole lockdown, because our biggest worry is that when the modeling was done, we didn't think that we would actually make the surge disappear. So the surge is going to come one way or another. So the lockdown would have had a limited impact, which it already has done in our case. But there are certain restrictions we still need to keep so that we can contain the numbers. Our biggest worry has been the fact that if with the lockdown, the level of unemployment goes up, the level of poverty goes up, hunger and food insecurity goes up, and therefore you need to balance, excuse me, you need to balance these issues. It also did affect some of the attention to some of the ailments, diseases of cardiovascular nature, diabetes, cancers, immunization, contraception, HIV, and so on. So if there's a lockdown, it's got additional impact. So we do need to keep a balance between economic activities, essential services, but also restrict the unnecessary issues that causes us to have a high bed occupancy and high rate of transmission. So the issues, for example, of alcohol comes into that regard, but also the issues of restricting the numbers and stopping meetings and closing the beaches. These are the areas which reduce the spread of the infection, and therefore there's a balance of us having to live now in a situation where we have to coexist with the coronavirus as part of our reality. The sooner we learn that, the better, because the best way of fighting this pandemic is for individuals to take personal responsibility to protecting themselves from getting the infection and protecting others in case they've got an infection, so that they don't unknowingly spread it through their droplet infections by not wearing the mask. If we focus on the behavioral change, we'll be able to make a huge impact. And of course, we need to also pay tribute to our health workers who have done a great job.
We both failed miserably with our timekeeping there. I knew you were going to give a long answer. I shouldn't have asked that question, but I had to. But thanks so much for your time, as always. Dr. Zweli Mkhize, the National Minister of Health, talking to us about COVID-19 related matters. Leanne, all we have time for is to say good and
see you tomorrow. Bye.